My name is Sam Bailey. I've been in treatment with Dr. Watson for about 2 years.
Why did you come to seek treatment?
I had been having problems with my health, primarily my sleep patterns and sleep apnea, along with when I was younger, I had 4 teeth extracted. My cuspids were, and I had braces that pushed everything back, closing up the spaces. In which case, I didn't have enough room for my tongue, so I had a lot of trouble breathing. My jaw was popping and not clicking.
Okay, so how long were you in braces?
I've been on braces periodically during my life, probably 3 or 4 different times.
Okay, all right. So when you first were when you were a child, when you were first in braces,
Mm-hmm.
when they first took those teeth out, is that?
Yeah, it was about actually it wasn't about 12 years old.
About 12.
Yeah.
Okay. So having these problems, I mean, what you said you experienced sleep apnea.
Mm-hmm.
How do you know that was sleep apnea?
Oh, I was tested. I went to a sleep center, and they said I had high levels of apnea.
And did they suggest any kind of treatments for you to?
Yeah, they gave me a big clunky CPAP machine that just blew air in my nose, and I couldn't maintain having it on throughout the entire night, and I really didn't see much improvement from wearing the CPAP.
So what kind of symptoms, but besides the sleep apnea, what other kind of symptoms were you experiencing?
Well, I didn't feel like my jaw was in alignment. When I would chew, I would feel a clicking noise. It was painful at times. Just didn't feel like my mouth my jaw was in alignment. It didn't feel like it had a home, like a resting place. I was constantly trying to move my lower jaw forward. So it was very uncomfortable.
Did you try to seek treatment besides the CPAP that you were given at the sleep apnea center? Was there any other kinds of treatment that you tried?
Yeah, I tried various
Yes.
appliances here that were recommended to me. One is similar to similar to what A.L.F is supposed to do, but it's very clunky. It's something I do myself. I twist it out and it pushes out all my teeth, but I don't think it does much with the jaw alignment aspect of it. I did this treatment.
For how long were you?
Oh, probably a year and a half.
So how often you would expand that?
Yeah, I think I expanded it every week. You would use a little twister and it would just.
So you didn't see any kind of changes in the symptoms that you were having?
Not really. I mean, because this thing is really clunky in the mouth. I couldn't breathe well because it was. So no, I didn't see a lot of changes with it either. So.
Okay. Anything else?
The other thing I got here was something I got more recently was this is a piece that was developed in Europe. It's like a tongue. The idea is that you, by keeping your tongue out, it's not falling back and closing up your airway while you sleep at night.
And so, and did that help you?
Not really, because the problem is my maxilla was pushed too. I was feeling a lot of pressure prior to A.L.F with my right here in my cheek, because everything was retracted, and this actually helped with retracting me more because it was putting pressure against to keep my tongue out. It had to push, back to, yeah. If I explain that correctly.
Wow. Did you try anything else besides those appliances? Did you have any other kinds of treatments to try to help with the problems that you were having?
Wow, it's been over so many years. I'm trying to recall.
Did you have any surgeries at all?
Oh yeah, I had turbinate reduction and septoplasty, which I got because I had apnea, and the nose doctor said it would improve my breathing, and it did, but it didn't solve my jaw misalignment issues.
You did. What made you feel that the alignment was still not?
Oh, with my jaw, well, due to the 4 teeth being extracted and everything being pushed, all my teeth being pushed back, yeah.
What changes? What happened when you came to Dr. Watson's office? What did you why did you pursue treatment with that doctor?
I felt like it was the right fit. I had done some research, and I thought I wanted to consider A.L.F, but there's not a lot of dentists that I saw that practice it. And when I came in here, I had researched you, and I saw that you did A.L.F, and I liked our treatment plan and everything, and I also like it. A lot of dentists don't want to work with adults because they maybe feel like the bones aren't going to move as well. The teeth won't move as well. But I've had really good results.
What changes have you noticed?
I feel like I have more room in my mouth. I don't feel as crowded. I can breathe better. I don't feel any popping anymore. No clicking noises. It's been pretty much a night and day experience since I started treating. It all started with a reversible headgear, which helped me move my maxilla forward, which really, I basically feel more in alignment with how I should be.
Did you, you said you had sleep apnea, were you also experiencing any problems with snoring or anything?
Oh, much snoring. I was keeping my wife awake constantly, really loud. I was told I stopped breathing in my sleep.
And so, do you see some improvements in those areas?
Yeah, I've been told I don't snore hardly ever anymore. It's very, very minimal, and when I do snore, it's pretty quiet.
What changes have you noticed? I see you have braces on, and I think you have A.L.F in place. But what changes have you noticed in your mouth so far?
What change have I noticed? Well, I noticed that where the A.L.F has been creating spaces in my mouth, so that I'll be able to put an implant in now later. Basically, I noticed I just feel a lot better than I used to feel. I don't feel the crowding. I just feel like I have a lot more room in my mouth.
You mentioned that, because you were an adult, you've seen other dentists that possibly didn't feel that they could treat you as an adult, or?
Yeah, what I found is a lot of dentists just view the A.L.F. They know about A.L.F, but they view it as an expander. They tell me that the results are not permanent, particularly with adults. That well, even with children, it will relapse back, and I don't think they quite understand how it works. So I've been told by a couple dentists that I seek that it was not something I should really even consider. That my teeth were perfectly straight, and they were. I had nice, perfectly symmetric, but cosmetically it looked good, but it didn't feel right. So.
Good point. Uh, you realize, the treatment hasn't been, it's taken some time. Your teeth are not exactly where they're supposed to be, but does that concern you at this point?
Not too much. I know I'm still in the treatment process, and considering how I feel, how much better I feel, it's something I can live with temporarily.